Hello again. Let's go into the drugs. So what I've got here are the pieces of paper that you get inside the packets when the drugs are prescribed. So I'm going to focus on the ones that Joyce is still on. That's the cocodamol and the gabapentin, and remember these are for the shingles, and basically shingles in her case looks like a severe burn, and it's improved to the extent that it's almost gone. You can just see very, very slight traces of it, but the neuropathic pain, the pain in the peripheral nerves is still there, which is why she's on this pain medication. So let's look at what seems like the more harmless one, the more innocuous one, right? Cocodamol. So that's 15 milligrams of codeine. Codeine, of course, is a highly addictive drug. And paracetamol. Paracetamol is regarded by most people to be pretty normal, average kind of thing, no big deal. When you start to do some deep research into paracetamol, you discover that it's very nasty indeed, particularly in terms of the effects of the liver and the kidneys. But let's not bother about my opinion. Let's go to what they've got to say. So first of all, they give some warnings and precautions. Now be prepared to start laughing, because this is all very funny. Right, warnings and precautions. Talk to your doctor, pharmacist or nurse before taking cocodamol if you are elderly and or in poor health. Elderly, she's 89, right? But she's being prescribed this, so there's a warning about being of an advanced age, and they're giving it to her anyway, so that sounds wonderful, doesn't it? Let's continue. Suffer from an enlarged prostate, suffer from any bowel problems. Well, she suffered from diverticulitis for years. They know that. You've given it to her regardless. Suffer from Addison's disease, suffer from any liver or kidney problems. If any of the above apply to you, it's important you speak to your doctor or pharmacist before taking this medicine, and they will decide what to do. It may still be safe for you to take this medicine. Do you see how contradictory this all is? I think they're hoping that you don't have a brain when you're reading this information, that you've become really dumb and stupid, because if you have any intelligence at all, you'll realise this is full of hypocrisy and contradiction. Do not take for longer than this directed by your prescriber. Taking codeine regularly for a long time can lead to addiction, which might cause you to feel restless and irritable when you stop taking it. Taking a painkiller for headaches too often or too long can make them worse. Okay, there's a whole load of things about if you're taking with other medicines, which I won't go into. Things about food and alcohol, basically no alcohol when you take this product. About pregnancy, driving and using machines. You should not be driving and using machines when you use this drug. It contains cochineal red A, which is a dye which is extracted from a kind of a beetle. That's not very nice for vegans, is it? Say the least. Right, so let's get down to the section which I think is the most significant of all. The possible side effects. Okay, here we go. If you experience any of these symptoms, tell your doctor or pharmacist immediately. Allergic reaction. Skin rash, itching, swelling or shortness of breath. Hang on a minute, hasn't she got shingles? Isn't that a skin inflammation? Isn't that what it is? And yet it says if you experience any skin rash, well, that's what she's got before she starts taking the drug, right? Serious skin reaction, she's got that already. Doesn't make much sense, does it? Sudden pain in the upper part of the abdomen. If you've previously had your gallbladder removed, she actually has had it removed. She has abdominal pain but lower down. The following side effects: feeling dizzy, drowsy, feeling sick or vomiting. She's had all of those. Lower heart, slow heartbeat, narrowing of the pupils, constipation. She's had that strongly. Stomach pain, she's had that. Lightheadedness, yes. Confusion or changes in mood, absolutely in spades. Bladder problems, okay. Itchy skin, that's the reason why she's been given this thing in the first place, because of the nightmare that she's been through with the neuropathic pain in the peripheral nervous system. Low blood cell counts. Okay, we don't know about that. So that's all pretty appalling, isn't it? That's the story. So the story is the thing that she's on doesn't exactly sit well with me, and at the moment I can't even contemplate doing anything about that yet, and I'll explain why in a bit. So let's go on to the next one. So the next one is called gabapentin. I should explain. Drug company manufacturers, apart from being incredibly courageously honest by giving us all this information, I think what they hope is that you throw it away without reading it. If you throw this thing away without reading it, you'll be none the wiser. So the next thing you notice, although it's called gabapentin, they don't actually call it that, they call it neurontin. So let's just add a bit of obfuscation and confusion by giving it two names. That will help to be a little bit more difficult to understand what's going on. And when it comes to people actually delivering the medicines, there's a little bit more reason for confusion as well. Okay, so here we go. Let's look at this one. Right. So the warnings and precautions are as follows. Well, don't take it if you're allergic to it. Well, that stands to reason. Warnings and precautions. Talk to your doctor or pharmacist if you suffer from any kidney problems, if you're on dialysis because of kidney failure, if you develop signs like persistent stomach pain, feeling sick, being sick, contact your doctor immediately, because they may be symptoms of acute pancreatitis, which is inflamed pancreas. If you have a nervous system disorder, respiratory disorders, or you're more than 65 years old, your doctor may prescribe you different dosing regimen. So, shall we just really get this straight? Both of these pain relievers that she's on, this is not the dirty drugs, these are the ones that we're supposed to be kind of okay about. Really not indicated for someone over 65, she's 89. Right, okay. A small number of people taking this drug get an allergic reaction or potentially serious skin reaction, which may develop into more serious problems if not treated. Read the description of these symptoms later on. Okay. Driving using machines, well, drowsiness, of course, you can expect that. So, let me just get to the juicy bit over here. Potential side effects. Okay, sit back, will be a while. Contact your doctor immediately if you experience any of the following symptoms after taking this medicine. Severe skin reactions that require immediate attention. Swelling, redness, hair loss. Persistent stomach pain, feeling sick and being sick. She certainly had feeling sick, had stomach pain. There may be symptoms of acute pancreatitis. We've had that in the previous drug, didn't we? Breathing problems, which if severe you may need emergency and intensive care to continue breathing normally. This drug may cause a serious or life-threatening allergic reaction which may affect your skin or other parts of your body like your liver or your blood cells. You may or may not have a rash when you get this kind of reaction. You may have to go straight to hospital or stop taking this drug. Call your doctor right away if you have any of the following symptoms. Skin rash. Ha ha ha, yeah, that's why she's been given it, because of this horrific skin condition, right? Hives, fever, swollen glands that don't go away, swelling of your lip or tongue, yellowing of the skin or the whites of the eyes. That, by the way, is a symptom that liver's very grossly overworked. Unusual bruising or bleeding, severe fatigue or weakness. She's got that in spades. Frequent infections. These may be the first sign of a serious reaction. The doctor should examine you and decide whether you should be continuing to take this drug anymore. If you're on kidney dialysis, tell your doctor if you develop any muscle pain or weakness. Right, so that was just the start, and now let's get down to the main course of the side effects. So first we've got the very common side effects. Viral infection, right, so you take this drug and that's going to help you to get a viral infection, which means your immune system has been seriously compromised. Delightful, isn't it? Feeling drowsy, dizziness, lack of coordination, she's got all that in spades. Feeling tired, fever, tiredness all the time, yes, no fever, thank God. So that's more than 1 in 10 people get them. That's very common. The common is, okay, just prepare yourself for this, will you? Common side effects: pneumonia, other respiratory tract infections, urinary tract infection, low white blood cell count, anorexia, increased appetite, anger towards others, confusion, mood changes, depression, anxiety, nervousness, difficulty with thinking. Common side effects. Do you see these drug companies? Aren't they clever? They manufacture something so bloody dangerous, and they get away with it because they give you all the information, which most people don't even bother to look at. Well, let's continue down this rabbit hole. Convulsions, jerky movements, difficulty with speaking. Absolutely. I understand about 10% of what she says at the moment. That was yesterday and the day before. Loss of memory, tremor, difficulty in sleeping, headache, sensitive skin, decreased sensation, numbness, difficulty with coordination, unusual eye movement, increased, decreased or absent reflexes, blurred vision, double vision, vertigo, high blood pressure, flushing or dilation of the blood vessels, difficulty breathing, bronchitis, sore throat, cough, dry nose, vomiting, nausea, problems with teeth, inflamed gums, diarrhea, stomach pain, indigestion, facial swelling, bruises, rash, itch, acne, joint pain, muscle pain, back pain, twitching, difficulty with erection, swelling in the legs and arms, difficulty with walking, weakness, pain, feeling unwell, flu-like symptoms, decrease in white blood cells, increase in weight, accidental injury, fracture and abrasion. Right, let's leave the common symptoms behind and move on to the uncommon. Agitation, which is defined as a state of chronic restlessness and unintentional and purposeless motions. I've been watching that one and felt the anguish you can imagine. Allergic reaction like hives, decreased movement, yes, racing heartbeat, I wouldn't know. Swelling that may involve the face, trunk and limbs, abnormal blood test results suggesting liver problems, mental impairment, absolutely. I keep saying it over and over again, absolutely. Fall, increase in blood glucose levels. Rare symptoms: decrease in blood glucose levels, loss of consciousness, trouble breathing, shallow breathing. Right, now, after all that lot, you think, well, surely we're done. Sorry. Still haven't finished. After marketing this product, the following side effects have been reported. Decreased platelets. They are the components in the blood which helps you to clot if you have a wound. Very important. Hallucinations. This has perhaps been one of the most distressing things of all. There have been a lot of hallucinations she's been experiencing from this. And my take on this, just to go into the shamanic take, listening to what she's been talking about, I have a feeling this takes the person into what we call the lower astral realms. This is not a nice place to be. In fact, you can look at my films, the multidimensional universe, and I go into that. I won't go into any more, but shall I say, just not very nice. Hallucinations, right. Problems with abnormal movements like writhing, jerking and stiffness, ringing in the ears, a group of side effects which could include swollen lymph nodes, fever, rash and inflammation of the liver, all occurring together. Yellowing of the skin and the eyes, yes, got that. Inflammation of the liver, acute kidney failure, incontinence, increased breast tissue, breast enlargement, adverse effects following the abrupt discontinuation of this drug. And they are anxiety, difficulty with sleeping, feeling sick, pain and sweating, and chest pain. Breakdown of the muscle fibres, change in blood test results, especially creatine phosphokinase increasing, problems with sexual functioning, low blood sodium levels and anaphylactic shock, which includes difficulty breathing, swelling of the lips, throat and tongue, and hypertension requiring emergency treatment. Finally, we've finished. That's right, I've taken you through everything on the gabapentin and everything on the cocodamol. Now let me ask you some really obvious questions. Would you want to be taking those? No. And the only reason why she's been on those is because the pain has been absolutely horrific off the scale. It's got to the point that it's not off the scale anymore, because she's not crying out every few seconds as she was doing, but she's still in pain. It's still significant, but it's way below unbearable. It's now at the levels of bearability. Right. There is something else I wanted to say, but to be honest, I'm just far too upset and distressed having read all that list out. So this is one of the things, you know, I'm a shaman, a shamanic practitioner. I'm highly sensitive and I'm empathic. So I do want to say this at this point. When my father passed, her mother, in 2010, I've been involved increasingly in my mum's life, and it's why I chose to be based here at this flat for a few years, around 2010, 2011, 2012, 2013. I would travel off to do my teaching people to be shamanic practitioners, but I keep coming back here, and that was the reason, because I knew she needed the support, she needed the help. So I've been involved with her for a long time. So being empathic, of course, to some extent I feel what she feels. And when she first phoned up to tell me about the experience with the shingles, I was feeling those feelings in my body as I was on the phone to her. Yeah, it's tough. So yeah, I'm just incredibly overall. And I suppose the other thing I want to say is I've noticed in the years since, but particularly the last few years, as things have been more difficult with her, you know, bless her, she's managed to stay off the pharmaceutical drugs for almost the entire 8 years. Very few exceptions, but I suppose that's why it's hitting me and her so hard, because she's managed to stay off them for so long, and now she's having the triple or quadruple or quintuple whammy of all these drugs, and now it's affecting her, now it's affecting me. So to be honest, every day I feel like I don't really have the words to describe how it feels. My energy levels are really difficult to cope, because I pick up on everything, of course I do. So I'll call it a day at that, and just thank you very much. And really what I'm getting you to do here is just, if you ever know anyone taking drugs and you're involved in their life, do the research. The drug companies are really honest. That's great honesty to tell you how appalling they are, isn't it? And my mum's only on these drugs because otherwise she would be in unspeakable agony, and instead of that she's on just bearable pain. Okay, thank you folks, cheers.